Assalamu alaikum. Welcome to our presentation. Today we are going to discuss a disease which is common in our community. It makes life difficult for the patients and patients suffers a lot regarding their social and financial issues. This disease comes in attacks and disturbs the normal lifestyle of the patients. Usually patient presents in emergency for the medical help. So we discuss bronchial asthma and its diagnosis. Asthma is chronic disorder of the airways that results in an array of respiratory symptoms and signs and is characterized by variable levels of airway expiratory obstruction and hyperresponsiveness. The most common pathogenesis of asthma include airway inflammation with eosinophils, neutrophils, and lymphocytes, especially T cells, goblet cell hyperplasia, plugging of small airways with mucus, collagen deposition beneath the basement membrane, bronchial smooth muscle hypertrophy, airway edema, mast cell activation, and denudation of airway epithelium. When we talk about the types of asthma, the most common type is allergic asthma, which usually begins in childhood and is associated with other allergic diseases such as eczema, allergic rhinitis, or food allergy. Asthma with persistent airflow limitation is thought to be due to airway remodeling. Asthma with obesity refers to prominent respiratory symptoms in patients with obesity with little airway inflammation. Selected individuals may experience asthma symptoms after exposure to aspirin or nonsteroidal anti-inflammatory drugs or tartrazine dyes. Other medications may precipitate asthma symptoms. Occupational asthma is triggered by various agents in the workplace and may occur weeks to years after initial exposure and sensitization. Women may experience catamenial asthma at predictable times during the menstrual cycle. Exercise induced bronchoconstriction begins during exercise or within 3 minutes after its end, peaks within 10 to 15 minutes, and then resolves by 60 minutes. Cough variant asthma has cough instead of wheezing as the predominant symptom of bronchial hyperactivity. Symptoms of the bronchial asthma includes episodic wheezing, shortness of breath, chest tightness, and cough. Symptoms vary over time and in intensity and are often worse at night or in the early morning. For the diagnosis of bronchial asthma, there should be some investigations, and the best investigation is pulmonary function test, which includes spirometry or PEF measurements. Both are important for the diagnosis and management of the patients with asthma. Important spirometry measurements include FEV1, forced expiratory volume in 1 second, and forced vital capacity, and FEV1 FVC before and after the administration of short acting bronchodilator. Bronchodilator response is defined by an increase in FEV1 or FVC of greater than 10% relative to the predicted value. PEF monitoring can establish peak flow variability, quantify asthma severity, and provide both patient and clinician with objective measurements on which to base treatment decisions. Other investigations include chest X-ray, which is usually normal in asthma patients and can only show hyperinflation. Skin or in vitro testing, including total serum IgE and allergen specific IgE, to assess sensitivity to environmental allergens, can identify atopy in patients with persistent asthma who may benefit from therapies directed at their allergic diathesis. An absolute eosinophil count can identify patients eligible for anti-interleukin 5 therapy to manage eosinophilic airway disease. Thank you very much.